Here is a patient who had a rotator cuff repair. Looking at the front of the shoulder, the first tendon we see is the subscapularis, which is a portion of the rotator cuff complex. In this patient is normal. Inside the shoulder, the long head of the biceps tendon is visualized and probed and brought into the joint, showing it is normal without any injury or tear. Just behind the biceps tendon is the supraspinatus tendon, the portion of the rotator cuff that is torn in 90% of patients. Here you can see the probe showing the hole in the supraspinatus rotator cuff tendon. Often from the outside, we will introduce a shaver device to clean up some of the soft tissue, as seen here in this picture. We next view from above, or call the subacromial space. We use this device, a radiofrequency probe or a heat probe, to clean up soft tissue, clean up edges of the tendon which were torn, to visualize the attachment for preparation for rotator cuff repair. Here you can see cleaning off of the bone or the greater tuberosity, which is where the tendon should attach. Here is some of the bursa fibers being cleaned up over the tendon. The edge of the tear is visualized here, lifting it up with the shaver, showing the detachment of the rotator cuff tendon. The shaver is also used to debride and clean up soft tissue and free up the edges of the tendon, which in this case are slightly frayed and degenerative. A clean edge is required to get a good repair. Cleaning up the bursa above the rotator cuff is necessary for pain relief and introduction of sutures through the tendon. This tendon will then be sutured back down to the bone. Here is a picture of the tendon now after cleaned up, pulling the tendon with a forceps device, showing that it is reducible back to its footprint of the greater tuberosity. Here you can see the final tendon after we cleaned it up. Now we are introducing sutures with a suture passing device. Suture anchors are drilled into the bone as seen here, and these sutures are then placed through the tendon, much like sewing clothing together. We tie knots, pulling the tendon back down to the bone. Here you can see the edge of the rotator cuff tendon firmly attached to the humerus, and all the knots are arthroscopically tied through the camera. Often, because rotator cuff tears and tendons are degenerative in nature, for the past year we have been using this device, a collagen patch from cow Achilles tendon, to augment our repairs. Here you can see the patch stapled on top of the arthroscopic repair to enhance healing of the tendon and also to protect our repair and sutures. This patch will incorporate into the tendon itself and be absorbed within the body within 6 months. The preliminary results of using this patch have been excellent, with increased healing rates and decreased failures. Here you can see the final image of the patch and repair. Thank you.